They get to you and let's say, for instance, gosh, they have a cancer. And all these things are racing through their mind. Oh my gosh, I have cancer. And then of course, their breast, which is a huge part of the female identity, is going to come into play as well. So they start thinking about, oh my gosh, not only do I have a life-threatening disease, but I don't want to be disfigured. So what is your general approach to how to talk to a patient that way? What do you tell them about their options, moving forward?
Welcome to the Doctor Health Channel. I'm your host, and today we've got two incredible guests joining us. Dr. Ramsey, a breast surgeon, and Dr. Steve Mapula, a plastic surgeon, both practicing right here in the Dallas-Fort Worth area. Together, they'll walk us through everything you need to know about breast cancer, from diagnosis to treatment, and the journey through reconstruction. So grab your coffee, get comfy, and let's dive in.
So it's very overwhelming, as you said. Usually I'm the first doctor that they're seeing after they were just informed that they have breast cancer. So their thoughts immediately race to the worst case scenario. But one thing that I like to start out with is that we have excellent survival rates when it comes to breast cancer. And especially because we're screening or we're starting those screening mammograms, we're catching breast cancers at a much early stage. So the majority of them, we can get them cured and they can have great survival. So I just like to reassure them with that it's not a death sentence or they don't need to, think about something so terrible, because we're gonna be able to get them through this. So when a patient comes in, I give them an overview of the type of breast cancer they have, and then I talk about the stage of breast cancer, and as I said, usually they're at an earlier stage. And then I discuss their options for treatment. So when it comes to treatment of breast cancer, we usually have 3 modalities of treatment. So we use surgery, chemotherapy, and radiation. And some women have a combination. You don't necessarily need all 3. But one thing that we always do, and what you and I do together, is surgery. So when it comes to surgery, patients have 2 different options for surgery, most likely, when they have a breast cancer. The first option is called a lumpectomy. This is where we're just removing where the cancer is. So we're removing that lump or that mass and some of the tissue around the tumor. So we're getting all the cancer out. Lumpectomy usually goes along with radiation. And what that does is it prevents the cancer from coming back. So it decreases the chance of recurrence in the breast. The other option for surgery is a mastectomy. And this is where we remove the whole breast. And I explain to patients that after a mastectomy, they have the option that they can go flat and be flat-chested, or we can work with someone like you and to provide them with excellent breast reconstruction.
So, I'm so curious between those options. Are the long-term survival rates? If they pick one or the other, are they equivalent? Is one superior to the other? What is the consensus on that?
Yeah, so there was a lot of studies on this, and the overall survival between a lumpectomy and radiation, we call that breast conservation surgery, and a mastectomy is the same. So either surgery that a patient picks, they will still end up living the same amount of time. There's a slightly higher percentage of local recurrence, of a higher risk of local recurrence in the lumpectomy plus radiation, but it's only about 1 to 2% higher. So we basically consider that as equivalent. And now we even have medications like anti-hormone pills that can make the risk of cancer coming back very low. Yeah,
so on the topic of hormone pills, because I think a lot of patients are out there and they're diagnosed with a breast cancer, and there's all this terminology that comes along with it. One of the things that you talk about a lot are things like a triple negative breast cancer. So can you tell us a little bit about what that actually means?
Right. So some cancers are fueled by the female hormones of estrogen and progesterone. And those cancers, we call them hormone receptor positive. With those cancers, after you're done with your treatment, if you have to do chemo or surgery or radiation, but usually after you're done with all those, you take an anti-hormone pill for about 5 years. And this just helps prevent the cancer from coming back. There are some other cancers that we call triple negative. So these cancers are not responsive to the female hormones, and they also are not responsive to another protein called HER2. Those cancers tend to be a little bit more aggressive. So if you have a triple negative cancer, we usually recommend doing chemotherapy before surgery.
Right, it's interesting. And so, you know, for those patients or any patient that has, say, a triple negative cancer, is there anything that predisposes patients to developing those, or is it just sort of luck of the draw?
We've noticed that triple negative breast cancers, they can be more running in families. So any patient that has a triple negative breast cancer, we would send for genetic testing. Also, we have noticed that African Americans tend to have higher rates of triple negative breast cancer. We're not entirely sure why, but it's a phenomenon that we've seen.
That wraps up today's episode. A heartfelt thank you to Dr. Ramsey and Dr. Mapula for sharing their insights and expertise on such a vital topic. You can find their practice details in the description below. If this conversation resonated with you or someone you care about, please share it. It just might make all the difference. And the best way to support this channel is to hit the subscribe button wherever you're watching. Until next time, stay informed, stay empowered, and stay healthy.